Good afternoon and welcome to today's webinar, Challenges in Providing Support to Caregivers of Autistic Children, a Social Worker's Perspective, brought to you by the University of Iowa Division of Child and Community Health, Child Health Specialty Clinics, and the Regional Autism Assistance Program. I'm Shawn Wittrock and I will be here helping to facilitate today's session. The session will be recorded and the link to that recording will be provided in an email following this webinar. You're free to type your questions into the question box throughout the presentation, and those will be answered at the end of the presentation. CE credits will be available to those attending the live session. Directions for obtaining those credits will be shared at the conclusion of this presentation. So with that, I am pleased to introduce and welcome our presenters today, Sally Rieck and Nadin Mustafa. Sally received her undergraduate degree from the University of Northern Iowa in 2004 and her graduate degree from the University of Iowa in 2012. Before attending graduate school, she worked in several residential and community-based agencies as a supported community living worker for children and adults with behavior challenges, developmental disabilities, and chronic mental illnesses. After receiving her master's degree, Sally was hired as a hospital social worker at the University of Iowa hospitals and clinics. She has provided social work coverage to many different areas of the hospital, including the mother-baby unit, inpatient and outpatient neurology, the medical, surgical, and pediatric intensive care units, and inpatient and outpatient pediatrics. She has been at the Stead Family Children's Hospital Center for Disabilities and Development since 2018, where among many things, she coordinates the transition to adulthood clinic, facilitates social skills groups for adolescents and young adults with social communication disorders, and provides support to parents and caregivers of children with autism and other developmental disabilities. Nadin Mustafa received her undergraduate and graduate degrees from the University of Iowa in 2010 and 2016, respectively. Before attending graduate school, she worked in several residential and community-based agencies as a supported community living worker for children and adults with behavior challenges, developmental disabilities, and chronic mental illnesses. After receiving her master's degree, Nadin worked abroad as a therapist in Abu Dhabi, United Arab Emirates. For 4 years, Nadin worked with children with autism in Applied Behavioral Analysis Center. After moving back to Iowa, Nadin was hired as a hospital social worker at the University of Iowa Stead Family Children's Hospital Center for Disabilities and Development. She has been there since January of 2022, where she provides support to parents and caregivers of children with autism and other developmental disabilities. So without further delay, I will turn the presentation over to Sally and Nadin.
Hello. We are having some technology issues, of course, so if I seem a little bit frazzled, that's why, but we're gonna get through this. So thanks for joining us. So you saw on the flyer, we have these different objectives. Okay, now I gotta figure out how to click through the slides with this. How do I do it on here? Oh, just that, okay. So yeah, we're gonna define the social determinants of health, identify ways in which economic and cultural barriers can hinder a family's ability to access resources that can help their child with special needs. Summarize the types of services and resources available to kiddos that have autism, and how we can advocate for the needs of patients and families who face some of the challenges that we're going to talk about, like the access to healthcare and other resources. So I'm sure that everybody's probably at least heard the term social determinants of health before. So the social determinants of health, as defined by the World Health Organization, are the non-medical factors that influence health outcomes. They're the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, developmental agenda or development agendas, social norms, social policies, and political systems. And so the SDH it's really huge and really broad, and I could do a whole thing on this, but I'm not going to, but that's just, it's important, I think, have that big definition just to, have that in your minds while we're going through all this different stuff. And so on this slide, these are some of the social determinants of health that the World Health Organization identified, but there are a lot more that just depending on where you look, you'll see different ones. But the ones I highlighted, income and social protection, education, early childhood development, and access to affordable health services of decent quality, those are the ones that I think really apply to what we do here the most. So kind of sprinkled throughout this presentation, even if we don't specifically mention these things, they're going to be referred to in some way. And so just a couple more things on the social determinants, how important they can be. So there's been research that said, you know, these social determinants can have even a more profound impact on a person's health than the lifestyle choices they make and the healthcare that they receive. There have been lots of studies that suggest that these social determinants of health are responsible for 30 to 55% of a person's health outcomes. And so, you know, again, addressing these social determinants of health is essential if we want to improve, you know, how people's health is affected and reduce like just these longstanding health inequities that we have probably all seen throughout our careers. Then, so going on to kind of some of the common challenges that we face here with our patients, and this is not by any means an inclusive list. There's a lot more that I thought of that I didn't put down on here. You know, parents not accepting when their kiddo gets diagnosed with autism to begin with. So that's challenging when you go in to try to talk about resources, but they're just in denial about their kiddo having this. Language and cultural barriers is a really big one, especially when we get into talking about, you know, the services and resources and applying for things. Where they live, you know, if you're in a rural area without a lot of resources, it's really hard to even get simple things like respite if you are on a waiver, which we'll talk about later, and just getting to appointments when you're far away. You know, economic and financial barriers is, you know, a really big one. People don't have adequate transportation to get to where they need to go. Health insurance doesn't cover things that are needed. A lot of parents we see have more than one kid, even sometimes like 6 or 7 kids that have special needs, and that can come with lots of behaviors and just tons of stress. Parents are extremely stressed because of these behaviors that their kids have, and that impacts how they can get to appointments and just how they receive the information that we give them. Sometimes there's this, you know, mom and dad and the kids, they don't have support. They don't have, you know, family or friends around that they can turn to when they need help. Some parents we work with have their own disabilities. You know, we have parents that have, you know, intellectual disabilities or learning disabilities, or even if they're physically, you know, challenged, that can all play into how they can help their kids. And then sometimes there's just misinformation about what resources are available. And that's something that I'll go into in a little bit also. And so this is just, you know, a list of some of the services and resources that we talk about here. Again, this is not at all inclusive. There's a lot more we could have put down, but this, we don't have time for that here. But waivers is probably the biggest thing. And I'll talk about each of these individually too, or we both will. Medicaid for kids with special needs, SSI, or, you know, supplemental security income, early access and area education agency referrals for the educational piece, family navigators through the regional autism assistance program, transportation for people that need help get into medical appointments that are urgent, and then diaper scripts. So the first one, where to go? Here. Technology.
So we can't move to the next slide.
Oh, there. Okay. So waiver programs. So every state has its own way of giving services to families, you know, people that have different disabilities. But in Iowa, we have what's called the Home and Community-Based Services Waiver Program, commonly known as waivers. They're funded through Iowa Medicaid, and they, you know, again, give services and supports to people that have disabilities. So the goal is to help these individuals remain in their homes or living in the community versus having to get care in a, medical level type institution, like, a nursing home or something like that. Once a person's on a waiver, they, have Medicaid coverage regardless of income. Right now there's 7 different waiver programs in Iowa, but they all have waiting lists. But there's a few that we focus on here. And the important thing is that you can help a person apply for multiple waivers. You can be on as many waiver wait lists as you need to be, but you can only actually be getting services from one waiver at a time. And so the 4 waivers that we primarily work with here are the health and disability waiver, the intellectual disability waiver, the children's mental health waiver, and the brain injury waiver. So for just a pure diagnosis of autism, if that's the only thing a kiddo has, like they don't have an intellectual disability, they don't have a co-occurring, mental health condition like anxiety, depression. The HD waiver is really the only one that we can apply for. And then, we know that oftentimes autism and intellectual disability go hand in hand, but not every time in every case. And so if we have kids that have both of those diagnoses, we talk about applying for the intellectual disability waiver as well. The children's mental health waiver is one that, kids that have autism and different stuff could, in theory, get that waiver. But what we've run into here is sometimes a person will suggest, apply for this waiver because your kid has autism, and then they come up for it and it turns out they won't get on that waiver because that diagnosis alone doesn't qualify them. And then the brain injury waiver is another one that sometimes, if they have autism and something else, they could apply for that one as well. But the big takeaway I want to, say here is when people are talking to families about what waivers their child's going to qualify for, just it's important to be cautious and not, I guess, for lack of better words, give them false hope. We've seen, people apply for the intellectual disability waiver when the kid's got an average IQ. And then they call us and say, well, we're up for this waiver, but we didn't get a spot. My kid didn't qualify. And then they didn't apply for the other ones that might be appropriate. And then they're left with not having the services that they might really have benefited from if they would have applied for a different one. And then the health and disability waiver, there's the extra step of even before you can get put on the wait list, a kid's got to be determined disabled according to federal guidelines. And that's another step that we'll talk about here in a second. So how do you apply for waiver services? If you have Medicaid, it's as simple as just signing a 1-page waiver request form. And here at the CDD, we help facilitate that. We'll see a family that has a newly diagnosed kiddo and just walk in and have them sign that form and then a consent, and that gives us permission to fax it over to Health and Human Services. And then, like I was saying, that there's that additional step of applying or being deemed disabled for the health and disability waiver, which can be done either by applying for Social Security, which I'll talk about in a minute, or there's a disability packet that the state can send a family. If a person has either, commercial insurance like Blue Cross or something, or if they even have Hawkeye, which is like Medicaid, but not Medicaid, they have to do a full application. And so we help facilitate that, but they take it home and fill it out and send it back to us. And even if parents don't feel that their child's going to qualify for Medicaid because of their income is too high, they absolutely have to fill out a full Medicaid app, even to get their kid on the waiver wait list. And we've unfortunately seen lots of parents that we tell this to, but then months go by and then they call us and they're like, yeah, we didn't send that in because we just didn't think our kid would qualify for Medicaid. So that's an important thing to remember. And so there's something else called Medicaid for kids with special needs, which is higher income limit. And it's specifically designed for kiddos that have disabilities typically used as a bridge to give kids Medicaid coverage while they're on a waiver wait list. So it's for anybody under the age of 19, if their income after taxes is 300% of the poverty level, and the child is considered disabled, again, according to those federal guidelines. And when someone are applying for waiver services, even if a family says, well, we make way too much money, we aren't going to qualify for that kind of Medicaid. We say just have Health and Human Services run eligibility for it anyhow, because you never know what's going to happen, just to cover our bases and be thorough. So then, like I said a couple minutes ago, applying for this SSI, or the supplemental security income, is one way to get that disability determination. A lot of families don't qualify for that because it's based on income and resources. And so they're not obligated to do that to get that disability piece done. The other way you can do that is by, so when you send the waiver application in to the state, they can look to see if a kid's been deemed disabled. They have a system, and they will often just send a family a disability packet to fill out. So there's those two different ways of getting that disability part done. And then, you know, if you do want to apply for SSI, the two main steps to doing that are to call the Social Security office to set up a phone interview, and then you have to fill out a disability report, either done online or by paper. And then, yeah, but so before Nadine starts, I think I wanted to say the reason that I focus so much on the waivers and Medicaid as part of this talk is because even trying to explain this, you know, as a clinician and, you know, to families that are educated, it's a lot of information, and it's really hard to kind of get people to understand all these complex processes sometimes. So imagine if you've got a family like we talked about with all those different challenges, you know, the disabilities the parents might have, the no support. It's real hard for them to even understand how that all works. And so a lot of times, unfortunately, stuff kind of just falls apart. You know, they don't get all that paperwork in, and then their kids don't make it onto the wait list for waivers or get that Medicaid because they just don't follow through with stuff. And that's tough. And then they call us 5 years later and say, we really need help. And they never followed up, and we just have to kind of start from scratch again. So I'm going to turn it over to Nadine now.
Right. So, Nick, one of the other services that we encourage our parents to apply for if they qualify is called early. It's through the AEA, or you might hear early access as well. The AEA provides educational services to children from birth to age 21 who have developmental delays or disabilities. The way that we explain it to parents, sometimes we'll think about AEA as this big umbrella, and there are 3 different kind of sections within it. One that many of you might be familiar with is the early access, and it's for children from 0 to 3 years old. And for this services are usually provided at home, sometimes in the community or sometimes in some offices. It depends on the situation, but mainly it's to help family with kind of having a plan to help their children at home. Once they're about to turn 3 and they still need the services, then they move on to the next year, which is the early childhood special education. If the child still needs services at that time, they'll start talking about developmental preschool, and it starts around the age of 3. And then once they move on to the school age, which is between kindergarten to 12th grade, then usually kind of school takes over, but we still are involved with making some referral as well. So you know, it says kindergarten to 12th grade, but children can really can stay in school up till age 21 because of the IDEA. So one of the biggest challenges we have with AEA or dealing with AEA and parents is that a lot of parents are misinformed And you ask them like, oh, do you have access to AEA? And they say, oh, no, we don't have it anymore. What happens is they just move from one tier to another tier. So you ask them, oh, does the child have an IEP? And they're like, oh, yeah, my child has an IEP. So we explain that you still involved with AEA, it's just a different tier. The other problem that we also face is that we do a referral, and either a parent will decline services because maybe they're not informed enough of what AEA does, or a lot of families do not want services in the home. They said, we don't want someone to come in our home, especially at the young age. Or parents cannot be reached. So 2 years later, they come from a different appointment. There's a note that they're involved with AEA. You ask them, they say no. So they never got contacted. So that's another challenge that we face. Another thing that we faced with AEA or dealing with the AEA situation is that a lot of problems, sometimes school will have problem with the actual IEP that the child has. The IEP is not followed, or school and the family is not really in sync. Then sometimes they will tell us and during clinic time. So with that, we suggest that they go back to the school, try to set up a meeting and try to mitigate and see where the problem is. If that doesn't work, we usually recommend the contact the family educator. Partnership is through AEA as well, and they sometimes help facilitate those conversations. If that doesn't work, then we move up to the next tier up, which is we give them Ask Resource. And the Ask Resource, it helps really negotiate, helps family negotiate with school, but sometimes it can go up to like involving legal as well. Okay. The next one is the Family Navigator, or the Regional Autism Assistance Program. They are who are parents or caregiver who have children with autism or other special needs through the Child Health Facility Clinic. They are wonderful when it to support our families with emotional support and help them navigate situations that can come up. We as social workers, we know like those big lines like, oh, these are the services in Iowa, but we might not know a special service in Dubuque or a rural town in Iowa. So our family navigators are great with that. Usually the contact is through the phone. They check in with them around once a month, and it really it depends on what agreement they have between the family and them. So they're a great resource that we use a lot with our family. So one challenge that we have with the family navigator is that sometimes family decline services and they say, oh, we don't need anyone to check on us. And they call us a few years later and they say, oh, I need help with this. And we reconnect them again with a family navigator. So another service that we tell our parents who are Medicaid recipients are that they can get a ride to medical appointments, or they can be reimbursed for the mileage to drive to the appointment. So going back to the list that Sally talked about earlier with people being far away, people not having financial issues, we try to, tell family who have Medicaid, like, you have this service, you can use it if you need it. So the way that goes, if they want a ride through the non-emergency medical transportation, they would have to call at least 2 days in advance, but not more than 30 days. Sometimes we help facilitate these rides, and sometimes we give information to the family to call and set up the ride. With a mileage reimbursement, the biggest thing is that you have to call ahead of time before you come to the appointment. You can't come to the appointment and say, I need to be reimbursed. It has to be done before you call, before you come to the appointment. In some cases, there are also services for meal and lodging as well. One of the biggest things that we face when it comes to NMT is, first of all, that parents don't know that this service exists. So we really try to, when we are doing our assessment, or if a provider brings it up to us that this family is suffering financially, we bring it up to let them know this is for you if you need it. The second problem is a lot of families will call us a day before the appointment and say, I can't get to my appointment tomorrow. Can you help me? Well, it needs to be set up at least 2 days in advance. So that's usually, we work with our scheduler to kind of reschedule the appointment and then set up a ride. So these are some of the challenges that we have when it comes to non-emergency medical transportation. The other service that we talk about with families is called diaper script. And it's also a service through Medicaid, and the MCOs that are with it. So the Medicaid will pay for the diapers or the pull-ups for kiddos who are 3 years or older, who have a developmental disability, like autism or intellectual disability. But the most important thing that there's a documentation is required by a physician stating that the child has full incontinence for a bladder or bowel. And so the biggest thing that we have when it comes to diaper script is that not a lot of pharmacies fill this script, and it's just increasingly it's been harder to find a pharmacy that will fill it. The second biggest challenge is that parents are not aware of the service. So all 3 Medicaid MCOs like Iowa Care, Mera Group, and Molina, and also service to fee-for-service Medicaid pay for these products as well. So, yeah. So on the next section, we'll talk about therapies, intervention. Some of these are provided here in the CDD, and some are just like the ABA is provided in not at the CDD but elsewhere. And we'll go through these therapies. Okay. So the first one we want to talk about is kind of the biggest thing when it comes to when our family gets their kids get diagnosed with autism. We take a kind of good chunk of time to talk about ABA. So ABA therapy, there's a lot out there about what ABA is, and there's a lot of good things and bad things that you hear. And that's the first thing we start off with, is that there's so much information out there, and we want to make sure that the parents are getting the accurate information what ABA is. So ABA in a nutshell is really the goal of the therapy is to increase positive behavior and decrease unwanted behavior. It really works on a lot of different skills: social skills, communication, academic, learning skills, hygiene, and a lot of different other skills as well. And ABA, it can be provided in so many different settings: at home, at school, at clinic, in the community. A lot of the centers that we have here in Iowa are like center-based, so you go to the ABA place and get services there. However, there are some schools are kind of now, there's a couple of school districts that they're doing it ABA services at school as well. And sometimes you can provide services at home. So it depends on the situation, but most of people get services through our centers, or, things like Balance Autism or Caravel or Stride, and just to name a few. Okay. So we have a lot of challenges when it comes to ABA. It really starts off with, as I said earlier, misinformation. We have a lot of families who come in. The moment you say ABA, say, nope, I'm not going that route. and you want to make sure you have a balance between, giving information without, saying, well, you have to do it. No, we say, you're the parents. You can decide what you want to do, what services your child wants to do. But I'm here to give you the information. I give them evidence-based practice, research, things like that to help them kind of, decide on what they want to do. So a lot of things we hear is like, oh, we heard it's the worst thing in the world. They really force our kids to do this and that. And I say, one thing, our rule of thumb is like, when you go to a place, you want to make sure that you're comfortable, and you want to make sure that when you take your kid there, that you feel like they're taken care of. So if a place is saying, we're going to change your child, or we're going to make them normal, whatever word they use, you don't want to go there because there's nothing wrong with your child. A good ABA place works on modifying behavior, not changing who the child is. And that's the biggest thing that we give to them. And again, we let them decide after that. So another biggest thing we find with ABA is like the geographical location. A lot of towns in Iowa are considered rural. There are many towns that they do not have ABA places with at least an hour. And ABA is a commitment. So research says it's about 30 hours is where you want to be. So imagine driving back and forth at least an hour. So a lot of families can do that because they have multiple children, because they have work, because they don't have enough gas to get to and from the ABA places. So another biggest issue that we have, just like the waivers, just like a lot of other services, is the wait list. Our parents are already waited enough to get diagnosis for their child, and now they have to wait again for them to get into ABA services. So sometimes it's average about maybe 1 to 2 years before they actually get into ABA from the time they wanted to get a diagnosis. Average is about, it really depends from where you live, the age of the child, the availability. There's so many factors that goes into how long is the wait list. Insurance coverage is also a big issue. So some insurance will pay for X amount of sessions, and some will say they put a cap on how much hours you can utilize. So also another big issue when it comes to ABA, once a family puts their name down on a wait list, then they decide, okay, we are coming up for a slot in ABA. Well, the kids goes to school. So what do? So a lot of ABA places ask for the kid to go full-time or 30 hours a week. And some kids need it and some kids don't. So they say, okay, well, I want my son to go to school or my daughter to go to school instead of going to ABA. So that can sometimes an issue that we face. Or sometimes they're like, oh, we'll take them half day. So either they go in the morning portion or the afternoon portion. Well, that puts a lot of stress on the family because they have to transfer back and forth every day between school and ABA. And last one, that at the end of ABA, we have a lot of challenges when it comes to ABA. And the last one I want to touch on is sometimes the referral process is confusing. You don't need an actual referral to go to ABA, but you need a diagnosis from a provider. So a lot of families who like they knew that their kid had autism or they were previously diagnosed elsewhere, they still need to be, officially have documentation that has the scores. And some places won't even put you on a wait list unless you have those scores. All right, so the second kind of therapy that we want to talk about is Bridge ABA, and Bridge ABA is really it's not an actual therapy. It's a CDD, kind of unique to CDD. We really help parents with if they are taking a longer time to get into ABA services, we want to make sure that they're getting some kind of help, and we bring them to the CDD. We give them some tips and things like that to work on these skills. The other therapy that we have here in CDD, but also it's there's a lot of other places who does it as well, is PCIT, or the parent-child interaction therapy. And it's done with parents and children. And the goal is really to decrease negative behaviors or unwanted behavior. It really helps to strengthen the relationship between a child and a parent. There's like a model that they use where you work with parents and you work with a child, and then the parents will have kind of an earpiece. You coach them throughout through the sessions. The age group is about 2 to 7, but there are some providers who will take a little older children if they are developmentally at a younger age. One thing about PCIT, the challenge that we find, it is a long commitment. It's about roughly around 16 weeks. So a lot of parents either drop out because it's just too long. Some parents don't find like they're seeing the progress quickly, so they drop out as well. Also, there lack of providers, just like a lot of the therapies that we have, and there's a huge wait list for that. So that's one issue that we find. And I'll turn it over to Sally to talk about the other therapies.
All right, so the next one is something called Project Impact. It stands for Improving Parents as Communication Teachers. This is, designed to teach kiddos that have autism and other social communication issues, basically 6 and under, how to communicate through play. So kind of teaches them to foster their kiddos' social engagement, communication, imitation, and play skills by just using different kinds of techniques. Develop like behavioral and developmental. It's kind of like a cross between play therapy and PCIT is how I've had it or heard it described. It can be done either, well, I guess the big thing I want to mention is it's not done widely throughout Iowa. That, as far as I know, we do it here and in child psychiatry at the university. I don't know that other providers in the state do it. Maybe if there are, that's awesome. But I know that we've had parents come from as far as like Davenport and Dubuque to do that therapy. There's either a group model or an individual model. I won't go too much into the differences, except for one involves parents coming one week, coming the next week with their kids to do the skills, and it's kind of in the slides. But it's pretty helpful. I've done it myself and seen a kid really, flourish and increase their skills. So it's kind of fun to see how that works. And backing up for a little bit, I wanted to mention earlier, and I kind of got sidetracked. So PT, OT, and speech, those are 3 kinds of therapies that we didn't put in the slides, but a lot of our kids need those because autism equals not being able to communicate, their speech issues, all that stuff. A lot of insurance companies don't pay for a lot of visits. Like we've had parents say, my kid had to drop out of speech because Blue Cross is only paying for 20 visits a year and they're going twice a week sometimes. And so if their child doesn't even qualify for that special kind of Medicaid for the kids with disabilities because the family income is too high, those kids are losing out on lots of valuable therapy and other kinds of therapies because of that. So going back to those social determinants of health, we think about these families being just, kind of poverty stricken, but it can really impact people that even do relatively well because, again, it's that kind of lack of insurance or adequate insurance coverage. So that's a big issue. So I want to make sure I brought that up because it's just something to consider when, well, why isn't your kid getting the therapies that they benefit from? It could be because of their insurance, even if the parents seem like they are relatively well off. Peers is another one that we do here at the CDD. And I know that maybe sometimes schools are implementing this, but I'm not sure on how big of a scale. But it stands for, I thought I put the acronym in there and I didn't. I can't think of it. I'm so sorry I left that out of the slide. But it's basically, teaching adolescents and young adults, different social skills, working with parents and their kids that have autism and other disorders. So the setup is it's 14 weekly sessions. I here at the CDD run the parent group of it, and then we have some speech language pathologists that do the kid group. And so we're up here talking about skills that had been worked on the previous week because they build on each other. And then downstairs the kids practice that. And so every week we come together and talk about, how that's gone. And it just works on different stuff like how to make friends, how to find places to find, people that you have things in common with, using appropriate humor, entering conversations, a bunch of different really cool stuff. Again, for this one, we've had parents and families come from as far as Des Moines to do this because it's just not done in lots of places. Program education enrichment of rational skills is what PEER stands for. Thanks, Nadine. And then I can't see what this says. Oh, the transition to adulthood clinic. This is one that actually I have a lot to do with. It's for people ages 14 to 30 who they can have a variety of different kinds of developmental disabilities. Even we've had referrals for just lots of mental health issues kind of things. So they come here, they meet with myself as the social worker, occupational therapy, and employment specialist and self-advocacy coordinator. And really we meet separately, not as a group, but just talk about all those big picture things. Like when you think about your kid or your young adult, either becoming an adult or branching out, what concerns do you have and how can we really help to address those and make sure that all your needs are met? So talking about things like making sure that they're connected with all the right resources, like applying for SSI if they qualify as adults, living arrangements, waivers, guardianship, and just a lot more than that. We can have psychology as part of that too, if maybe a person might need to have updated testing for, if they're on a waiver and need that to keep the services for the ID waiver. Then, so we're kind of getting to the last part of the presentation now. So how to advocate for our patients and their families. There are, lots of gaps in services and, things that we want to see happen, but don't. The biggest thing I can think of off the top of my head that I put in here is just advocate for change at the state level for like modifying how waiver programs work, because one of the biggest challenges that we see is, a child that maybe has a diagnosis of autism, IQ wise, they are fine. They don't qualify for a diagnosis of an intellectual disability, but with their adaptive skills, their abilities to do things on their own independently, they're really low. And so they kind of function like a person that has intellectual disability, but they just don't qualify for that waiver. And the health and disability waiver does not have all those really awesome services like supported community living and just things that really help people live independently. So I just say, write your legislators. And I've heard that there was legislation to kind of combine waivers, but I think it fizzled out. So just, keep on talking about it, advocate for that. Make sure our patients and families are just as informed as they possibly can be about all the resources available to them, like including transportation if they have Medicaid, so they can get to these appointments, and then all the other stuff we talked about. Just listen to your patients and their caregivers with an open mind and try not to be judgmental. It can be so hard because families call us with the same concern over and over, and it's like, we've talked about this so many times. But just thinking about all those different barriers they face and how challenging it can be for them to follow through, it's kind of nice to really take a step back and kind of take a walk in their shoes. And we know that we're all really busy, but just it can be as simple as spending an extra few minutes with the family at the end of the visit to really hear what they have to say and understand what they're going through. That can just speak volumes. I don't know how many times a parent has called me with all these different things that I have nothing else to offer except for just empathy. Like I hear what you're going through and I know it's difficult. You're doing the best that you can. You're doing everything you can. So I think really just trying to be a little bit more soft and, spend time if you have it just to hear them. So that brings us to I pick the cats. The highest form of knowledge is empathy because it requires us to suspend our egos and live in another person's world. I thought that was just a really fitting kind of way to end the presentation. And we do have, I think, still time for questions. There were 3 that Sean sent us ahead of time. So I think I was going to answer the first one. Yeah. So how do you support a family with a child that has an autism diagnosis and aggression? Are there any autism inpatient placements? And so the first part of the question, just try to do the interventions that we talked about, ABA therapy, speech therapy is huge because a lot of times if a kid can't communicate, that's why they're acting out, because they don't know how else to get their, what they're trying to communicate across. And the question about placement. So there are places throughout the state they're called ICFIDs, or intermediate care facilities for people with intellectual disabilities. Balanced autism is one of those. And so while it's specific placement for kids with autism, unfortunately, a person also has to have that ID diagnosis. And so without that, it's hard to find placement. There are, you know, like PMICs, pediatric medical institutions for children, for kids that have behaviors. So there's options out there. And again, that's a lot more to go into, but it's like everything else, to find placement is challenging because there are wait lists, and there just aren't a lot of, there aren't enough places like this for all the kids that need it. And Nadine will do the second one.
All right, so the second questions ask about behaviors in children with autism. And again, these behavior can range with like severity range from mild to really severe. And so what the idea is for us to make sure that we do all the work ahead of time before that crisis happen. And just as Sally said, all these intervention with OT and speech and PT, whatever they need to intervene early, getting them connected with early access, and then AEA after early childhood. And then again, getting them to ABA therapy. But there are some times you have done all that and there, you know, depending on the child, there is no cure or no pill for the true autism or the aggression that comes with it. But there are some medication that can be prescribed for aggression, or if a kid has like a coexisting condition like ADHD or things like that. But as far as from a behavioral perspective, here at the CDD, we have two different biobehavioral services. And we did include it in our slides because it's a whole, we wanted to mention it at the end because I knew this question will come up when it comes to behavior. So one of the clinic that we have is called Biobehavioral Clinic. It's we have two doctors who run it, a psychologist, Dr. Matt O'Brien and Dr. Kelly Shields. It's a 2-hour appointment. You come in, they do a lot of, you know, they read your chart and make sure that, you know, they're knowing that why the referral is happening. And they ask a lot of questions regarding the behaviors. And the aim of this appointment is to make sure that we get a whole glimpse of why this behavior is happening, and do a hypothesis. We think this behavior is happening because they want attention or tangible or escape. Then once you do that, you can give some directions to parents on to a recommendation on what they can do. These, and a lot of our psychologists, they work with the school. So these recommendations can be in the school, they can be for the family and through the community. But also the biobehavioral clinic also works as kind of like an assessment to see if this child needs more than just these recommendation, but they need an actual more intense program. And that's where the day treatment program comes in. And the day treatment program is a 2-week program that you come into an outpatient clinic. So it's not, you're not staying at the hospital. You come in for part of the day, about 3 hours for 2 weeks. And they do similar to what I just said, but then more intense. And they look at behavior more intense, and they work on treatment with the child and the family. So these are some of the things that we have here at the CDD if the challenges, the behaviors are really challenging. And the third question?
And the last question that we had ahead of time is there advice to help parent or caregivers talk with existing or potential employers about their schedule and work needs? The first thing I would say is, you know, look at the option of using FMLA or Family Medical Leave Act, because sometimes if a doctor can fill out paperwork just kind of saying the kid's getting this much therapy, they have these many appointments, I've seen that be done. And other times we've had doctors that can simply, you know, very objectively write a letter that saying that this child has this diagnosis, this set of, you know, needs. And sometimes an employer can look at that and say, okay, well, if a doctor is saying this, they may or may not accept it. It's hard to say for sure. It depends on, you know, if the employer wants to be, you know, forgiving or, you know, understanding. Actually, I was thinking back, we had one family reach out because they specifically wanted dad to get his work schedule changed from, I think, day shift to night shift, and I can't remember why. But we wrote a letter for that reason. I don't know what the outcome was, but that's just kind of an example of, you know, what we can do to help. But unfortunately, our abilities are limited to just, you know, providing objective documentation. And, you know, probably would be helpful to have education on a larger scale for employers, just to know these kids have these issues and these parents need to work. So please work with them, but it's a big variety. What other questions are there? So there's stuff in the chat. Should I open that up, or does Sean want to do that? I don't know how this works.
So I can go ahead and just read those aloud. So there was one question about what is the household income cap for Medicaid? And I can pull up the link for that too and provide that.
Yeah, and was that, do they mean for Medicaid for kids with special needs, I wonder? Or I almost put that in a slide and oh, hi Lexi, you asked that. I can actually email that later. But yeah, it's, if you Google MKSN Iowa, it comes up on there. For regular Medicaid, I don't know. But
and I can go ahead and also include those links when I send out the recording and the handout in the follow-up email.
I was going to make a slide with a bunch of links, but just I didn't do that either. How does a family apply for a RAP worker, a family navigator? How do they qualify?
Usually it's a referral. We usually ask the family in their visit, we have the service, are you interested? And if the family say yes, then usually our providers here will put in a referral. I've talked to the family navigator and they say any providers can do a referral for RAP. So,
and families can call themselves too, because in the autism folder that we hand out when we go over the information, there's actually a RAP flyer in there, and there's a number that parents can call themselves too.
And I did in the chat, I just sent the link, or I put in the link for the RAP brochure. So that has all of the contact informations for the regional centers.
Awesome. Will early access / AEA still work with a child if they are diagnosed with autism? We have seen them hold off on evals because they felt autism was likely and suggested an autism eval before moving forward. So, I mean, in the state of Iowa, we're called a non-categorical state. So a child does not have to have a specific diagnosis to get services. It's supposed to be based on, you know, if a referral is made, they do an evaluation. If the evaluation is what determines if the kid qualifies for services, but I know there's a specific AEA I'm not going to name that has been known to be much more particular and not as willing to provide stuff as others. So,
and I've seen also some other families who their kids are coming for evaluation, so AEA is holding off on their evaluation until they get seen here first. Then they come and they continue their evaluation. So it's just a matter of like them coming to the appointment first, and then AEA comes in, which sometimes that slows things down. Sometimes also another thing that comes up during the summertime, if a kid is around the preschool age and is supposed to be in preschool, they wait until the school opens, enroll in preschool, and then they provide, then they come to the school and do evaluation then. So there's a lot different ways why they might be holding off evaluation.
One more down here.
Yeah, so
what if there is not an actual diagnosis yet, since that can take some time to obtain? What is your guidance on the in-between and ways to help families? Oh gosh, we get these questions quite a bit. I think it depends on what the parent's particular need is. Actually just had an email this morning about a mom, the kid's scheduled to come in February of next year for an autism eval, but they're worried that this little girl's going to lose her emotional support puppy if she's not diagnosed. and I don't know if the landlord is asking for a specific diagnosis or a letter. We can't write letters, you know, supporting those kinds of animals for different reasons. But I think just, you know, knowing that they can still maybe get their kids into like speech therapy, they can get their kids evaluated if they're 3 and under for early access services. Just knowing that a diagnosis is not required for things like special education, certain kinds of therapies, you know, ABA and I, we've got to have autism diagnosis, but there's, you know, quite a few things that can be done without a diagnosis. And if parents reach out to us, we just kind of like look at what the concerns are and give them whatever information we might be able to for their specific situation.
And just one thing I'll say, one of our biggest challenges is the wait list for kids to come to get evaluated. And this is a problem that our triage team has been trying so many different methods, and they're working really hard to figure out what is the best way to get kids in as soon as possible. We have so many different autism evaluation team within the CDD, but there's not a whole lot of not a lot of people who diagnose autism in the whole state of Iowa. So that's the issue. So the wait just to get diagnosis is long time. And that's one of, I think, the biggest challenge that we have. Families are already tired by the time like, oh, we've been waiting for a year to get in here. And then you tell them like, well, I'm sorry, you still have to wait for waiver, you still have to wait for ABA, you still have to wait for this. So that's definitely one of the biggest challenges that we have.
And I do see we have a few more questions. I will follow up via email since we are out of time, but I do just want to let everyone know for attendees who would like to claim continuing education credits, the University of Iowa Carver College of Medicine has an online portal to complete the course evaluation and then download the attendance certificate. I did put the link to that portal in the chat for everyone, but you will also be receiving an email that has step-by-step instructions to access the online portal and complete that evaluation. And then if you do have any questions regarding continuing education, please feel free to contact me, and I'm putting my email in the chat now. So again, just to be respectful of everyone's time, this will conclude our presentation for the afternoon. And I want to sincerely thank you, Sally and Nadine, for your information and presentation today, and for all of you who attended. So have a wonderful afternoon.
Thank you. Thank you.